good afternoon all. So next will be the Microvision quiz, and to participate in the quiz you need voting pads, and the voting pads are there on the chairs itself, right? So please use those voting pads that is there right behind your chairs. तेरा भी बहुत चल रहा होगा।
देखे जरा किसमें कितना है दम जम के रखना कदम मेरे साथिया देखे जरा किसमें कितना है दम जम के रखना कदम मेरे साथिया
देखे जरा किसमें कितना है दम जम के रखना कदम मेरे साथिया
देखे जरा किसमें कितना है दम
लैपटॉप
जम के रखना कदम मेरे साथिया देखे जरा
So the quiz will have two sets of two parts. The first part is all about science, right? Questions will be there. The second part is all about science with fun. So the questions are quite simple. No need for senior ophthalmologists to leave the house. There are questions for you also. So please stay here and use the voting pad that is there behind your chairs. And first we'll go through the scientific round that will have 50 questions. So there are enough options, enough opportunity for each of one of you to perform well. After that, we'll move on to the audience questions. So now I would like to invite Dr. Manpreet Kaur. She is going to be my co-quiz master. And Dr. Anu Malik, she will be the neutral quiz master. Anything goes wrong, she will sort it out. And if all the things goes wrong, then now we have a habit of going to Supreme Court of India. So we have Supreme Judge Professor Namta Sharma with us. She will be joining us very shortly. Manpreet?
So let us take you through the introduction of the quiz. So all of you have your voting pads, right? So the rules are quite simple. Just as soon as the timer starts, press whichever option you feel is right, A, B, C or D, and the results will be announced at the end in this session only. So just let's go to the side. So the participant of course must be a registered delegate. The quiz is played on the basis of right answer and the speed of answering, which will be recorded automatically through a virtual platform. We'll have two warm-up questions before we start the quiz, and individual question prize can be won only once by any participant. We'll have an interesting audience round after the initial rapid fire round, so stay tuned. So these are the prizes. Dr. Prabhu, you would like to announce?
So the winner will take 30,000, second runner up 20, third runner up 15,000. This is for the first round, and there will be 2,000 cash awards for fourth and fifth people. There will be 5 pen drives for next 5. For audience, we have a lot of pen drives and a lot of special prizes for each questions. Okay. So warm-up question. Before starting the question, let me clarify one thing. In contrast to other quizzes that you must have participated, here the timer will start the moment question is displayed on the podium. Okay. So no need to wait for me or Manpreet to complete the reading of that questions and options. If you could read on your own and press the buzzer, please press the button. No need to wait for us to complete the questions, right? So first there are 2 warm-up questions. Just check if your voting pad is working fine. If there are any issues, then we can correct that. Our Microvision team is all around. You can request them to change that voting pad. So identify the correct sequence. I think our AV team is not happy with the quiz. No, we're just checking. So the timer should start. You are not starting the timer. Okay, it's there. I think it's not in my laptop.
6
Okay.
seconds
So
left.
remember that is the timer that is going to come the moment the question is displayed. So no need to wait for me to read the questions. That's why I didn't read the questions. So you should press the button the moment timer starts, right? So anybody in the audience, we can give our first chocolate whoever answered this correctly. What is the right sequence? Come on. Raise your hand. Okay, Dr. Amit Parwal, he is the winner. Please give him a chocolate. So it's all of them are right. Pavan Kalyan is known as Power Star. Alu Arjun is Stylish Star. Chiranjeevi, the Mega Star. And so all of the above are correct. Now the second questions. Manpreet, you can read this question.
This is just to check your attentiveness level. Identify your quiz masters. So A, Dr. Praful, Dr. Annu Malik, B, Dr. Praful, Dr. Manpreet, C, Dr. Rajesh, Dr. Namrata, and D, Dr. Madhu and Dr. Manpreet. So as you can see, you have 30 seconds, now 16 left. So at the end of timer, beyond that, whatever you press will not count as an answer.
This is a mandatory question. Anybody who answered this wrongly, you will not be considered for award. So please know your quiz masters properly.
So okay.
So again, let's go to audience. Anyone? Oh God.
Oh God.
Who are those 25%?
So the rest 25% you really need to buck up to make it to the end of the quiz.
So now the proper round starts. So Manpreet, you can start. This is not the proper round, huh?
This
the
is the
promotional
mandatory advertisements we have.
Okay. Get set, go. Manpreet.
So the first question, a 35-year-old chronic alcoholic with history of recurrent abdominal pain presented with diminution of vision in both eyes with the following fundus picture. Possible diagnosis is A. CMV retinitis, B. CRAO, C. Posture retinopathy and D. Hypertensive retinopathy. The timer. So 10 seconds remaining on the clock.
Okay, can we see the responses? Okay, 70% correct. So again, I am emphasizing this. The moment question is displayed, you press the button. The timer starts from that moment only. Okay, don't wait for the next slide to be displayed.
So the answer was correct. C. Posture retinopathy. We are collating your scores and it will be discussed at the end of the surgery. So the second question, subretinal dose of TPA, tissue plasminogen activator in microgram per 0.1 ml. Option A is 25 to 50. Option B is 200 to 500. Option C 100 to 200 and option D 50 to 100. So 18 seconds left on the clock.
Okay, let's see the responses. Okay, very poor response.
So the correct answer was D 50 to 100.
So which of the following statement is true about the device depicted in the picture? A. It is placed in the dominant eye. B. It has a central aperture of 2 mm. C. It is an irreversible treatment option for presbyopia. D. It is FDA approved for only phakic presbyopes. Okay. Anyone from the audience who can tell us what ring is this? Sir, you have already taken one. Anyone? Please go to sir. Navneet, go fast. Arey dodo Microvision team. Run. Camera ring, okay. Give one chocolate to sir.
So it's FDA approved for only phakic presbyopes, and it was a camera ring with a 1.6 mm central aperture. So slit lamp image of a patient on day 1 post refractive surgery, which is the likely procedure that the patient has undergone: A. Photorefractive keratectomy, B. Phototherapeutic keratectomy, C. Laser assisted in situ keratomyosis, or D. Small incision lenticule extraction. 15 seconds to go. So can we have the bar? Okay, that's a very
Again
mixed
37%.
house. So
I hope your voting pads are working fine.
can anyone tell the diagnosis? Can anyone raise their hand and tell the diagnosis?
Post LASIK
Microvision
trial.
data. So post LASIK flap try is correct. So the correct answer is C, LASIK, not SMILE.
Okay, a 16-year-old male presents with complaint of poor vision in both eye. On examination, the IQ was 36 and 42. Slit lamp pictures are shown below. So, what is false about this condition? A. The inheritance is autosomal dominant pattern. B. It is often associated with dental anomalies. C. Caused by defective neural crest migration. D. Risk of glaucoma is 25%. So, you have to choose which is false. Okay, responses please. Again 30%. I think we are stuck with 30%. So the risk of glaucoma is more than 50%. Almost always the glaucoma develops, it's not 25%. So question number 6, all of the following are true about the drug teprotumumab. Even this, I can't pronounce this. It's a monoclonal antibody that acts by binding with IGF-1 receptor. It is FDA approved for thyroid eye disease and IG4 related orbital disease. C. It decreases exophthalmos. D. It decreases diplopia. Response? It was true, accept. 27. Chalo, you went further down. We were expecting little higher, then you went down. So it's approved for only, yeah, the explanation is FDA approved for thyroid disease and IG4. That is false. It's only approved for IG4. So which timer start kar diya? Arre? So answer this.
Which serotype of adenovirus is not implicated in the pathogenesis of epidemic keratoconjunctivitis? We recently had an epidemic, so everyone should be knowing this. 8, 19, 21 or 37, which is not implicated.
Any clue, Manpreet?
No clue. All of them are adenovirus serotypes, and it's a ratta question actually. So anyone from the audience before we have the graph? 21. So can we have a chocolate for Dr. Vinita? So the correct answer is 21. So 8, 19 and 37 are associated with epidemic keratoconjunctivitis, 3, 4, 7 with follicular. A 27-year-old lady comes with complaint of foreign body sensation in the left eye since 2 days. She has history of trekking in forest area. Eyelid examination reveals the following picture. Identify the clinical condition. Pityriasis pubis, tick on the eye, Demodex follicularum longus, Demodex follicularum brevis.
Watch it carefully.
15 seconds, yeah. So the clue is to in the details of the picture actually.
Look at it carefully, right? 1, 2, 3, 4, 5, 6. Let's see what is the response after a clue. Wow, 48%. That means we must have to give them clues for each questions. One free.
Yes.
Okay, next question is, A 2-year-old male child is brought to OPD with the following clinical picture. True about this clinical condition each. It presents at birth in all cases. It doesn't increase in size when the kid is crying. Systemic evaluation is required in case of multiple lesions. Spontaneous resolution occurs in all cases. Let's see the responses. Okay, 54. So this is probably the best answer so far. So okay, we'll go fast because I think we are getting short of time, Dr. Manpreet. A patient complained of foreign body sensation and photophobia. There, there are no signs of cells in antechamber or foreign body. All of the following statements are true for the condition below except A. It is characterized by inflammation of superior bulbar and tarsal conjunctiva. B. There will be filaments in cornea which are rare. C. Thyroid disease is associated with 30% of the cases. D. Conjunctival redundancy is often present. So all of the following are true except identify the wrong one.
For those coming in later, there is a voting pad at every seat. So if you want to participate in the quiz, just take the voting pad. Okay. So can we have the response, please?
Okay, we are back to 30% zone. Manpreet, next questions.
Okay. So, okay.
Okay,
You
she
have
gave
already
you a
seen the
perfect
answer,
two.
but yeah. When was the World Sight Day celebrated this year and what was the theme? 12th October 2023, Love Your Eyes. 10th October 2023, Love Your Eyes. 12th October 2023, Love Your Eyes at Work. Or 10th October 2023, Love Your Eyes at Work. So we have just gone through the World Sight Day the last week only. This week. Can we have the answer? So yeah,
Best so far.
yeah, because we already showed
Something
you
is
the
wrong.
answer.
In
I
spite
think
of showing the answer, people are still
they're not
36%
paying
are still not
attention.
interested.
So the primary role of intelligent phaco is prevents complete occlusion of the phaco tip, minimizes phaco energy, activates aspiration bypass system, enhances complete occlusion of and promotes phaco chop. So you have 20 more seconds left on the timer. So this is the science round. After that, while the results are being collated, we'll have the fun round. So for those who are in the 30% of that 60% bar, we'll have the fun round for you specially. Can we have the bar, please? So it prevents, the answer was A, prevents complete occlusion of phaco tip. Identify the suturing pattern. Can we have the timer? Talk, anti-talk, no talk, sem-talk.
Manpreet, what is same talk?
That is what I was going to ask you.
In
Did
that
we run
picture-
out of options
in
by
that
making the
picture You were
question?
working on computer, so this question must be set by you. It's semi-talk, okay? It's not same-talk, it's semi-talk.
So now the option D is definitely incorrect. Can we have the answer? Yeah.
Okay.
So the correct answer was C, no torque. Which type of big bubble is this? 1, 2, 3, 1 and 3 combined.
Which type of bubble would have formed? Watch carefully, right?
And this one goes to the audience, so anyone would like to volunteer what actually we are seeing in this picture?
After the timer stops.
After the timer stops, yeah. Anyone from the audience, what are we seeing in this picture? What are the two layers being seen? Microvision. Can you please stand up over there so that the mic can reach you?
Microvision
Yeah.
team, आप audience पे focus करो, not on the quiz masters.
On the mic, sir. We can't hear. उसने वो award दिया।
Mic तो लेके जाओ कोई. Okay, you can
You
tell
can
us
come
from
up.
there only. Type 1, 2, 3. Type 2. Okay, so he's partly correct. This is type 2. But as I said, look at this. This is already Descemet membrane which has already been exposed. So there was type 1 plus type 2 bubble. So this was the type 3 or
Bubble,
mixed
three,
type of bubble.
yeah,
Right?
in which two bubbles were formed, pre-decimatic and stroma, and the Duas layer basically, and Duas and decimates.
AV team, please be alert. Now we are going to rush through the questions. Okay. So which of the following is not an option for this condition? Look at the condition and tell us which is not an option. Option A, intracameral air rate. Option B, intracameral C3F8. Option C, intrastromal fluid drainage. Option D, compression suture. Look at these things and then decide. Okay, responses please. Okay, very poor. So it was a case of hydrops, recalcitrant hydrops, multiple fluid pockets, so intracameral air wouldn't have helped. Scleral incision diameter for 27 gauge vitrectomy each. Option A 0.64 for 23 gauge. I think this question is completely wrong. So option B 0.51, option C 0.4, option D 0.34.
Please get 100%.
Please
in
read
this
the question carefully. Now this question we want 100% response. That's why we have prepared this question.
And this is to check the authenticity of the voting pads. Can we have the scoreboard in this one?
AV team.
Oh God.
78%.
So, which is not an early sign of PCR, sudden deepening of the anterior chamber with momentary constriction of pupil, sudden transitory appearance of a clear red reflex peripherally, newly apparent inability to rotate a previously mobile nucleus, excessive tipping of one pole of the nucleus. 17 seconds left. So the answer was A, sudden deepening of the anterior chamber with momentary constriction of pupil. Only 14% got it right. According to the ocular hypertension treatment trial, which of the following is false? The target IOP reduction was 30% or more. 5-year risk of POAG decreases from 9.5% to 4.4% with treatment. High intraocular pressure and thin CCT were significant risk factors on multivariate analysis. No significant association was observed with myopia and diabetes. Answer was A, the target IOP reduction was 30% or more, 17% got it correct. Identify the correct aberrations: coma spherical, trefoil coma, defocus spherical, or trefoil spherical. The correct answer was D, trefoil spherical, answered by 26% correctly. Angle alpha is between red and green, red and blue, green and blue, none. So red indicates the visual axis, green the pupil center, and blue the limbus center. The correct answer was red and blue. So as you can see, is red is the visual axis and blue would be the optical axis. Which of the following is not FDA approved for dry eyes? Loteprednol, lifitegrast, cyclosporin, prednisolone phosphate.
Not FDA approved for dry eye. All of them are used for dry eye, but one of them is not FDA approved. Okay. Can we see the response? Can we have the leaderboard? Is it possible? After 30? Okay. So what is the advantage of this drug in dry eye? A, 24-hour drug delivery. B, punctal blockade. C, tear stimulant. D, it's a mucolytic. Lacri's shot, as you can see. What is this advantage? Okay, responses please. Wow, and almost 140 people participated in this question, so that's great. So it's basically inserted in the fornix for 24-hour drug delivery. A 40-year-old male presented with decrease in vision in both eye with this clinical picture. Visual acuity was 6/18 both eye. Fundus and OCT picture are given below. So what is the diagnosis? A, is it a macular hole? B, it's a retinal artery microaneurysm. C, it's a polypoidal choroidal vasculopathy. D, it's a macular telangiectasia type 2. Okay, responses please. 34%. We are again back to that 30% zone. Which of the following is useful in OSSN? A, topical interferon alpha 2A. B, topical interferon alpha 2B. C, topical interferon alpha 2B. D, topical interferon alpha 2B. Please note the strength also. At times less is better. Okay. Oh, very poor response. Okay. So it's alpha 2b 1 million in it, right? So Foster Kennedy syndrome is characterized by A, ipsilateral optic atrophy, contralateral papilledema. B, ipsilateral papilledema, contralateral optic atrophy. C, ipsilateral optic atrophy and contralateral normal disc. D, ipsilateral normal disc and contralateral papilledema. Foster Kennedy syndrome. The confusion is between ipsilateral and contralateral. Okay, the responses please. Wow, 61%. That's great. हो क्या आ गया? Okay. So Trihallu is a natural bioprotector. Okay, most common cause for loss of vision in golden hour syndrome is A, corneal opacity. B, corneal astigmatism. C, foveal aplasia. D, optic atrophy. Responses please. So golden hair lead to dermoid, dermoid leads to astigmatism, astigmatism leads to amblyopia. That is the cause of loss of vision.
Harboyan syndrome is characterized by A. CHED, B. Nystagmus, C. Vision loss, D. All of the above. So this is an easy one.
This is an easy one for cornea specialist, Manpreet. TTL sir has given you a clue, all of the above, but I cannot confirm it is right or wrong.
Can we have the answer?
Okay, again 140 people participate. Wow.
Oh, this I
Wow.
think is the
So
best question
Manpreet,
of the all.
Sir's clue worked. है ना?
Yes. So the refractive index of a PMMA IL is 1.41, 1.47, 1.49, 1.75. The last question I think was even better than the one in which the answer was in the question.
Those who are joining late, please see wherever you are sitting, there is a voting pad there. You can use that to participate in the quiz.
Can we have the scoreboard? Answer is D 1.75.
Oh no,
only
almost all of
7%
us
got
have
correct.
used this lens, IOL, but the response is so poor. Next question, Manpreet.
What's the cataract surgical rate in a population of 5 million people, where 1200 cataract surgeries were carried out last year? 24, 240, 2400 or 24,000?
Mathematics, you need some good mathematical skill here.
The answer was 2400.
Again,
How many got it correct? 37%, not bad. Last question before we have the scoreboard. Which of the following is a source of blood supply to intracortioscleral portion of the optic nerve? Long PCA, short ciliary arteries, perineural plexus, none of the above. Can we have the audience poll? Okay, so 36% answered correctly. C, perineural plexus. Can we have the scoreboard for now?
Can you have the winner board? Okay.
Okay.
So after this, there are 5 or maybe 10 if time permits. So all these persons who are leading the board, you know, you still have 5 more questions to
Maintain the
get
lead.
onto the top, right?
Who's keypad 30? Okay, over there.
Keypad 30 is
321?
missing.
No, she's there. 321 is there. Keypad 13. So anyone who wants to win, please shift to the left hand side of the hall.
Or you can
Keypad
stop
60.
pressing them from pressing that voting pad.
Keypad 60. Okay. Keypad 45. So our top 5s are distributed in the middle area. So now on to the last 5 or 10
See here
questions,
timing
yeah?
does matter, right? So those who are in tie, you have to press your button fast. है ना? Keep at 30 is above 321 because of the time. So last 5 questions, right? So which recti muscle has the shortest tendon? A, lateral recti, B, medial recti, C, superior recti, D, inferior recti. Shortest tendon, not muscle, right? Responses, please. Okay, wow, 55% correct answer. The limitation of Bunsen-Roscoe law that is used for CXL application in accelerator CXL is A, it is not valid for tissue like cornea. B, oxygen dependency. C, works within a certain dose range. D, availability of covalent bonds. Which of the following is the reason why this law doesn't apply to CXL cornea. Again, quite easy from Manpreet standard. Bhalla sir, any clue? Okay, show me the responses. Fast. Okay, 33%. The lowest stimuli size used in Goldman's visual field is A 0.0625, B 0.625, C 6.25, D 64. At times the odd man out may be correct, but not always. And the quiz master may confuse you. Okay, responses please. Okay, 15%. Oh, that's good. The most common clinical ocular change associated with psoriasis is A. Is it cataract? B. Is it glaucoma? C. Is it blepharitis? D. Is it dry eye?
Can we have the responses? Okay, so around 50% answered correctly. D, dry eye. So coming to the last question, identify the person in the image. A, Mark Amsler. B, Jack Copeland. C, Theodore Maiman. D, Carl Koller.
Retina people must be happy to see this question.
For those not pressing the keypad and not participating, the fun round is mandatory, which we'll move on to next after this. Can we have the responses, please? So 24% answered correctly, 3 Theodore Maiman. So, okay.
So we are not going to next questions now because we'll start our audience round. Yeah.
So while the results are being compiled, we'll move on to the second segment of the quiz, the audience questions.
Now before that, team, please be ready with mics. How many mics do we have?
I have one.
Manpreet, you have to sacrifice your mic. You can't participate in the audience quiz. Le lo mic le lo, है ना? So okay, so we'll begin with your first question. So these questions are basically on general knowledge, current affairs, and little bit movies and little bit science. So the first question is, thank you to the LOC team for this wonderful conference in this wonderful city. Now to all of you, which of the following is not a name for Visakhapatnam? A. Vijayapatnam, B. Vizag, C. Visakha, D. Walter. I could see a lot of hands. Now Microvision team.
Visakha.
Visakha, okay. One more chance. Microvision, जो तुम्हारा प्रोडक्ट लिख रहा है उसके पास जाओ.
Visakhapatnam.
Vijayapatnam, okay. Any more?
Except Visakha, all are Visakhapatnam names.
So this is audience round. You can create your own option also. Answer may not be A, B, C, D.
They can be
I've already
googly
given a
answers
clue.
as
C,
well.
C,
Dr. Bhalla,
C.
A. No. No, I've already given you a clue.
C.
No, put the mic to ma'am because she has decided this
Ma'am
venue.
said no.
All must be knowing this.
A I said.
C is the correct.
Okay, who said all of the above? Sir, TTL sir. Okay, that's the right answer. So all these names are there
We have a
for
chocolate over there.
Visakhapatnam.
Walter
also. Yes, Walter is a quite popular name, I think, right?
People from Visakhapatnam can tell us, is Walter a popular name? Who all are from Vizag here? Walter is a popular name? Okay.
But still you didn't answer. Somebody from North India answered that. This is not good. Okay, we move on to our next question. This is Manpreet's question.
Okay, can you identify the technology? And this question has a part B, so be prepared for that. Can we have the mic over
Ingenuity.
there?
Ingenuity.
Okay, part B now.
Not Ingenuity, 3D heads-up display, it's an RTO. Okay, so
But-
part B.
you'll-
Which song based on I does this picture represent? You have to sing 2 lines. First identify the song.
Any song
So
that describes this.
The clue is looking somewhere else and operating somewhere else.
तुझे देखा तो ये जाना
No, no, no,
जाना।
no. That this is not your Sanam.
No, 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 no.
Ma'am,
Like
Vinita ma'am.
somewhere. Now you have to sing. Microvision team.
Sing with an emotion.
With the emotion.
Into it.
Oh, yes.
Not just somebody has already
Mic पे
Sung that.
Vinita.
Mike,
आंखों
let
की
me.
उस्ता किया
किसी ने
Who
पूरा
can
गाना ही
sing on
गा
the
लिया।
mic?
लिरिक्स नहीं आते इसके आगे कहीं पे निगाहें कहीं पे निशाना आगे lyrics
We
नहीं
have
आता
one more volunteer. Maybe in more.
No,
He
जो अच्छे
sings
से गाएगा
better.
उसी को
This is a
मिलेगा।
little more modern. नजरे मिलाना, नजरे चुराना, कहीं पे निगाहें, कहीं पे निशाना.
Okay, this is Badshah version.
Excellent.
2 chocolates. I hope we don't get.
Microvision, if
we
you
don't
don't
run
move,
short
your
out of
product will
chocolates.
also not move. Please move with the mic. Chalo, next.
Okay. So again, I'm going to read the question. Ma'am is going to read the question. Guess the song.
गुलाबी आंखें जो तेरी देखी शराबी ये दिल हो गया.
Who's
Who is
singing
singing?
so well?
I can't see the mic. Okay. you are from
Excellent,
here.
excellent. You sang very well.
Thank you. 1 chocolate, please. Okay, there is song also. Okay, now little bit science. See this image. What does the image suggest? A. India beat Pakistan. B. India beat Pakistan yesterday. C. India beat Pakistan on Saturday. D. India beat Pakistan on 14th October. So all these are not relevant to the question. So you have to give the answer on your own.
All of the above.
No.
The question is, what does the image suggest?
See, options are not suggesting the answer. You have to tell us the answer. These are all wrong answer, but right facts.
Anyone wants to tell
It's
the
not in
answer?
ABCD. See the image and tell us the optical phenomena. What does this suggest? See carefully.
Spherical aberrations.
Very good, but you have to refine it. Spherical aberration of what lenses and what is this phenomena called?
This is the parafoveal rays or the paraxial rays are focusing on the fovea, and the non-parafoveal are the distant rays. This
Yes.
is the law of Snellen, basically.
These rays are going out of the eye.
Oh, yeah. So these are spherical old time
Anyone?
IOLs.
Anyone? Okay, we'll give it to you. Anyone with the classic name? Okay, 1 clue. Afiki glasses.
Jack in the box.
roving rings को
Very good. This is a roving ring scotoma. You see the rays that goes out, that creates a blind spot. So this is a roving ring scotoma. Okay, Manpreet.
So in Game of Thrones, how many are Game of Thrones fans? Can we have a show of hands? Okay, so this question is for you. Melisandre tells Arya Stark, brown eyes, green eyes, blue eyes you will shut forever. So which pair is correctly matched? Brown eyes, Walder Frey, blue eyes, Cersei, green eyes, Peter Baelish, brown eyes, the Night King. Okay, we have one over there.
So these are not from Andhra movie industry. So please be
blue
careful.
eyes Cersei.
Wrong answer. Can we have someone else? No, sir, wrong answer.
Green eyes, Peter Bale.
Only 2 options left.
Brown eyes, Walter Frey is the correct answer. We have Dr. Bhalla giving the correct answer. And may I know your name? Dr. Hardik Nanavati. So we have 2 right answers from over here.
Okay.
So these are the brown eyes.
Apne se.
I have no clue what the question is, but
That's why it's
a blacksmith history of hammer chisel trauma, best corrected visual acuity 6/9, best treatment option
See this?
is which one? A, B, C, D.
A. Lens aspiration with IOL. LA is not local anesthesia. B. Spectacle. C. Contact lens. D. Observation.
D observation.
D. Observation. जिसने भी बोला उसको चॉकलेट नहीं देना. Next.
LA with IOL.
Who? LA with IOL. But you have to tell us why.
Because it is a foreign word.
Yeah, it is a hammer chisel injury, so it's an iron piece. It can lead to sidrosis. So you have to operate such cases. Thank you. नहीं अभी है. Okay, listen to this carefully.
Natu?
What is Natu?
Option C. Folk dance.
What
folk
is Natu?
dance.
What is Natu in Oxford Dictionary? Okay, that is the question.
Desi dance.
Folk dance.
Song चलने दो. Now, responses please. Anyone?
Folk
Desi
dance.
dance.
D nun.
Who said that? D none?
D nun.
Okay, why? Could you explain that?
Because it is Oxford Dictionary. and
Very
not Indian
good. So it's a
dictionary.
local language. It's a Telugu language. You won't find this in Oxford Dictionary. Nice answer. Okay, in 1911, he received the Nobel Prize for his work on which of the following? You have to guess the name and the reason for which he received the Nobel Prize. Okay?
Alvar Gulfstrand. Slit
अरे,
lamp.
माइक्रोविजन तुमने वो माइक परमानेंटली दे रखा है क्या? शी इज आंसरिंग एवरीथिंग. No, this is bias. You have to give the mic to somebody else.
Over there. Can we have the mic over there? Left hand side. Yeah. पीछे.
Anyone? Okay, this is Albert Goldstein, that's right. But what was the work for which he received Nobel Prize?
The dioptrics of the eye.
Dioptrics of the eye.
Hello?
Anyone beg to differ?
Schematic eye.
Schematic eye, which is not there in the option. Good one. Then anyone?
It's the slit lamp.
Is the slit lamp. Anyone? अरे एक ही तो option बचा है.
Dioptrics of the eye, sir.
Yes, the first answer that
Schematic
ma'am,
eye.
dioptrics of the eye, that is the right answer. But he was involved in developing slit lamp as well as reflex-free ophthalmoscope. Okay, so okay, Manpreet.
Okay, so you have to say it with emotion. The famous movie dialogue based on lacrimal secretions. Okay, can we have the mic over
No,
there? With
no,
full
no young
emotion.
guns, please. We
And
need
we
the
can have
senior
multiple
most
contestants
ophthalmologist.
here.
Pushpa, I hate tears.
Anyone who can bring in more emotion and drama to the dialogue?
Pushpa, I hate tears.
Not in Rajesh Khanna style. You should tell this in Rajesh Khanna style. Any Rajesh Khanna fan?
Pushpa ji, I hate your tears.
ये तो जोकर वर्जन हो गया.
Pushpa, I hate tears.
Pushpa Ray, I hate your tears. I modified little.
Okay, now it's up to Manpreet to take a call. Who is the winner?
I think the one in pink.
Okay, his voice was too much painful.
Yes.
बोला
Okay,
कैसे था वो तो दिखा दो.
नहीं है क्या? Okay, now little bit science and ma'am is going to ask this question. She is the cornea specialist.
What is the advice to this patient? You have the topography here and you have the clinical picture.
So what would you advise to the patient? I can give you choices. Yes, A, protective glass, B, collagen cross-linking, C, steroids, D, penetrating keratoplasty. This was the image. It's absolute silence. People are more interested in Rajesh Sinha than reading topography. Diagnosis.
They've actually
Ma'am
come
can
out
tell
of
you the diagnosis. Ma'am, give them a
they
clue.
have come out of the science world and they are into fun mode and now you put
Superior pellucid.
Okay, very nice diagnosis. Don't give him any chocolate for the rest of the questions.
Glasses, spectacles.
Glasses, spectacles, okay.
It could also be because there is
Steroids?
No, you are right, sir.
opacification at the edge.
Yeah, you're perfectly right. Pellucid very rarely can manifest like this, but this is a classical, ma'am will tell you.
Tyrian's marginal
It's a
degeneration.
Tyrian's marginal degeneration, right? So for Tyrians, what is the perfect advice? Yes, somebody saying protective glasses. That is the right answer, right? Because it's not encroaching upon visual axis. So you can simply prescribe protective glasses because even trivial trauma can lead to corneal perforation. Okay, sing the Bollywood song that includes all of these in that song. Liner, I, life, sacrifice and world. After 10 seconds I can give you a clue also.
हिंदी में बोल दो तो उस
Hindi I don't know, you have to tell us. I don't know literal meaning of Hindi.
The liner would be kajal, eye would be aankh, life would be
All these words
Okay,
have
this is the clue. Anyone?
कजरा मोहब्बत वाला अखियों में ऐसे डाला कजरे ने ले ली मेरी जान हाय रे मैं तेरे कुर्बान.
Okay.
Excellent, excellent.
Can you play the song a little bit? Let's hear the proper music also.
आँखों में प्यार
Okay. Now listen to this. This is probably the most popular movie, right, from Telugu industry. So don't go by that. So in this movie, the hero does some smuggling of some woods. Now, if you use that wood in eye, what it is going to cause? A. Toxic endothelitis. B. Chemical injury. C. It will halt myopia. D. It will reduce inflammation.
Chemical injury.
Chemical injury.
Chemical injury.
अच्छा इसका डायलॉग तो सुनने दो क्लासिक डायलॉग
போகணும்னு நினைச்சாதான் போவேன் ஏந்து புஷ்பானா ஃப்ளவர் நினைச்சிங்களா ஃபயர்
Okay.
Fire.
So chemical injury. Any other options? Toxic endothelitis. Any other choices? अरे और दो ही तो ऑप्शन है कुछ भी बोलो.
फ्लावर बोल रहा है ना टॉक्सिक एंडोथेलिटिस.
फ्लावर बोल रहे तो टॉक्सिक एंडोथेलिटिस. Okay. Anything else?
Question fun है, answer science है.
Answer is about science. This is from a published literature. Okay, so I think nobody is answering this question. So somebody is murmuring.
Reduces inflammation.
Reduces inflammation. That is the right answer. And you will be surprised to know these are the health benefits of sandalwood, red sandalwood. One of them is it has anti-inflammatory activity. But don't put it into your eyes. Don't put the wooden piece. You know that is the extract from the sandalwood. Okay, you know him quite well. He is the counterpart of your Bahubali 1 and 2, Rana Dagubati. So suppose this patient comes to your OPD and you are doing a slit lamp examination, what would be the most likely finding in his right eye?
Corneal graft.
A. Is it a normal? B. Multifocal IOL. C. Corneal graft. D. Emulsified silicone oil.
Actually, he is having prosthetic implant.
Okay.
Corneal graft.
Corneal graft. Any other options?
He has a prosthetic.
Lohit. Prosthetic eye is not there in the options. Suppose he would have turned up 10 years back, then I am revising the question. One option is yes, corneal graft. Any other? Lohit, you are a retina people. You should be knowing this.
So you have to answer emulsified silicone oil, Lohit.
Silicone oil.
Okay, but that is wrong. The first one was right answer, corneal graft. He underwent cornea transplantation when he was a kid at LB Prasad Eye Institute, and he is one-eyed practically. That graft failed. Okay. So Manpreet,
Guess the actress by the eyes. A yesteryear actress. So for the first 3 rows. Amisha Patel.
Gadar 2.
No, wrong answer.
How many times you have watched Gadar 2?
Shreya Saran.
Shreya Saran. Manpreet, do you know who is Shreya Saran?
No.
Dekho.
I don't even know her. Anyone else?
Rekha ji.
Oh,
Who
G.
was this?
Who said that term? G. Rekha G.
Can you stand up? We can't see you amongst all the slides. Who gave the right answer?
Rekha G. Somebody said Rekha G. Okay.
Over
So
there.
that's the right
That's
answer,
the
I
correct
think.
answer. Can we have Rekha ji on screen, please? Yeah.
Okay. What has been done in this patient? Watch carefully right and left eye. A. Both eye, the patient has undergone penetrating keratoplasty. Right eye penetrating keratoplasty, left eye artificial eye. Left eye PKP, right eye artificial eye, both eye artificial eye. Anyone?
B. Right eye PKP, left eye artificial.
Pardon?
B.
B. Right eye PKP, left eye artificial eye. Okay. Okay, that's the right answer. But I request you all to give a round of applause for this patient. He is one of our ex-army commander. In a terrorist attack, he's lost his one arm, one eye, but he has 660 vision in right eye. With that, he is still managing. So this was the eye. You can see sutures here, right? multiple switches. So right eye PKP. This was the artificial eye. He is wearing. Okay, so this is a question from cricket lovers. Yesterday India won against Pakistan, but what was the first instance where India and Pakistan met, and what was the outcome, and which was the city?
1992.
1992, where? Sydney. You can expect this from Titya sir only. Okay, so give it to Dr. Titya. So in 1992, India and Pakistan met, and India won that match with 43 runs. A pen drive to sir. Okay, so how many more quiz awards we have left with, Navneet? No, audience prizes.
How many more audience prizes we have? We have.
So that means you are not giving anyone anything, huh? You have all the awards. Okay, what does the logo stands for?
WHO.
WHO. जिन जिन्होंने WHO बोला उनका award वापस लो. Anything else? I have given a clue in the beginning. The ABCD may not be right. You can have your own answer. Israel? No.
UNICEF.
UNICEF? No. IAPB? No. It's United Nations logo. Okay, it's not, it doesn't belong to any I organization. That is the clue. Ma'am is saying that thing was not there, so you can have your own option for audience questions. Right? So, an eye for an eye will make the whole world blind. This statement came from which country? From whom? USA, Russia, Syria, Ukraine? USA. Okay.
India, Gandhiji.
India.
Very good. I think sir answered that first. It was a statement by our great father of our nation, M.K. Gandhi. Okay. Okay, now
so,
Manpreet.
Name 2 suspense thriller Hindi movies with blind protagonists. There are many.
Andhadhun.
Who starred in it? Who was the... Yeah, Ayushmann Khurrana. So who said Andhadhun, Ayushmann Khurrana? Can you stand up? Okay, the second one.
Kabil.
Sorry, come again.
Kabil.
Kabil. That's also correct. Who was the protagonist?
Ritik Roshan.
Aankhein and Akshay Kumar.
Ritik Roshan.
I think Kabil was Ritik Roshan. Even I'll have to.
Kabil, Ritik Roshan, very right.
Anyone else? There are more movies also.
Aankhein and Akshay Kumar.
What procedure had Ayushmann undergone? Eye procedure. Anybody?
Corneal transplant.
Corneal transplant. Very good. Anybody?
No, he's an actor. So what
Ayushmann.
procedure?
Sir is not asking in movies.
In that movie.
No,
Actually,
not in that movie. In reality,
Reality.
what procedure has he undergone bilaterally? He's an actor.
PRK. Good. किसने कहा PRK? Or any other answer? Bilateral LASIK.
He's too old for smile and too.
In Chandigarh. Chandigarh.
Okay. So Manpreet, you didn't tell us who is winning the award.
So we have 4 movies. They haven't guessed all. So these are some of the movies over the past few decades. Andhadhun, Ayushmann Khurrana, Kabil, Ritik Roshan, Vada, Arjun Rampal, Aankhein had Akshay Kumar and Arjun Rampal and Paresh Rawal, and Qatl had Sanjeev Kumar.
पुरानी आंखें थे यार. I think it was Sadhana
Yes.
or Sunil Dutt.
Okay, that
Sunil Dutt.
that was beyond my Google search, I think. So all those who answered the movies correctly, can we have prizes for them? please?
576.
Why, Jack? You are still stuck with that first question. 576. No, I haven't read the question. So you are not eligible to answer. What is the megapixel of human eye? Anyone?
576.
570. Anyone differs?
I think it is 10232.
Anyone? There are 2 choices. No third option. Okay, it's 576. Give it to her. Okay, Manpreet.
So any Witcher fans over here, only they are going to get the answer. Rest can guess. It's
Okay,
free
Witcher
for
is
all.
a movie. How many of you agree? Raise your arm. No, they know that.
It's a Netflix series.
Yes.
How many of you know that? Okay, so in Witcher, what is the color of Geralt of Rivia's eyes? Blue, green, yellow,
Yellow.
or purple?
Yellow.
Somebody is a hardcore Netflix viewer.
Yellow.
Yes. Who has purple eyes? Can you tell me? In the same series?
The witch, I don't know her
The
name.
mage, yeah.
The witch.
The mage.
Okay, witch in Witcher. Okay. Here is the spectrum of witches and their eyes.
This is Henry Cavill. Come on, people have him as a wallpaper.
Okay, now this is the last question we'll end with here because so the first part is without music. Just watch this, identify the actress and try to do the lip reading. Tell us what is she talking about. What disease she is talking about? It's related to ophthalmology. There is a clue in that video.
Dry eyes.
Who said dry eyes?
Okay, so here is the video with music. So she is a brand ambassador for Sire Industries who are involved in innovation in dry eye.
Know me so well. They can tell what I'm thinking just by looking in my eyes. But what they didn't know was that I had dry, itchy eyes. I used artificial tears from the moment I woke up to the moment I went to bed. So I finally decided to show my eyes some love. Some eye love.
Eye love means having a chat with your eye doctor about your dry eyes. Because if you're using artificial tears often and still have symptoms, it could be chronic dry eye.
It's all about eye love, my friends.
So this was the awareness campaign about dry eye, and I think with this we'll end here. And now I request our AV team to tell us who are the leaders, and I would like to request Tityal sir, Bhalla sir, and ma'am, Dr. Bhanati ma'am, to distribute the awards. Please come on to dais. Dr. Piyush, Dr. Bardhaman, all of you please come on to. Dr. Amit was also here. I hope he is around. Okay, so please come on to dais. So we have 5 winners, Navneet, right?
6, 7, 8, 9, 10. Then 1, 2, 3, 4 like that.
So people who are already leaving know that they are not going to get the award.
6, 7, 8, 9, 10 दिखा रहा हूँ.
So now Microvision team is confusing me completely about the award. So I request Navneet to tell.
So can we have the scoreboard? We'll have 5 consolation prizes first.
Just 1 second. I want you to give a round of applause to our quiz masters, Dr. Praful Maharana, who've done a great job, and for Manpreet Kaur, it is a debut. So please give a round of applause for her.
Yeah. So can we have the slide with the consolation prize winners? We'll have 5 consolation prize, then which are pen drives, then 4th and 5th prize 2,000 each, then the 1st, 2nd and 3rd prizes. So can we have the scoreboard? Okay, so keypad number 60, keypad number 45, 14, 107 and 304.
Come on, give them a round of applause.
60, 45, 14, 107 and 304. Can we have your names please so we can announce?
Dr. James Adams.
So first we have Dr. James Adams.
I'm Dr. James Adams. I'm the director for Agarwal's Eye Hospital, Visakhapatnam.
I'm Dr. Sudhakar, CMO of Shankarai Hospital, Guntur.
Wow. I think this is probably the best quiz I have had. All senior ophthalmologist directors, chairmen, they are winning the awards. It's a great thing to see.
Okay, I'm Dr. Manas. I'm from DRRI Hospital, Chennai.
I'm Dr. Madhavi from Regional Eye Hospital, Visakhapatnam.
Hi, I'm Dr. Hardik Nanavati from Shantilal Sangvi Eye Institute, Mumbai.
Next, Manpreet.
Can we have the first top 5? The fourth and fifth one first, please.
It's a repeat. 309.
पहले चौथे और पांचवें है ना? 309 फोर्थ और फिफ्थ पहले बताओ ना, फिर 3 2 1 करेंगे.
309 first is runner up, second runner up, then third, then fourth. Sorry. No, where is 305? No, it's not there.
So that was 304.
No, it is 304 actually.
Can we have the next slide,
Yeah.
please? So the third prize is keep at 309. Sir, you are 309.
309.
So this is the third prize, 309. It's cash prize. 309 is a cash prize of 2000. Yeah, it's a cash prize of 2000.
There is no cash prize. As per the GBM, we will convert it into registration or travel or whatever. Worth that much only, whatever you have promised them.
So it's the third prize. That's what matters.
Person is here on the stage.
So it was a pure science quiz, I think. All the senior people, science rich. Next prize can we have on screen? The second prize, keypad 106. After this, we have the second runner-up, first runner-up, and the first prize. Correct? Yeah. So Microvision have completely confused us regarding the prizes. Okay. Can we have the second runner-up on screen, please? Keep at 13. अच्छा कोई ना. Can we have the first runner-up on screen? Keep at 321.
321. Wow.
Can we have a big round of applause? Yeah.
I am Megha Gulati. I am a vitreoretina consultant at LVPI Vizag.
And now for the grand prize, can we have on screen the first prize? Keep at 30.
30 gives 30,000 rewards. Wow. Great combination. I think this is a good good coincidence. She will get rewards amounting to 30,000 and her keypad number is 30. Navneet, ये पहले से तो plan नहीं था.
Yeah, I am Dr. Ramya Seetamraju, cornea cataract and refractive consultant at Agarwal, Visakhapatnam.
Wow. So the best thing about this quiz is this time instead of residents winning all the awards, we are getting directors, faculties, they are getting all the awards.
Yes, sir.
Yes. Navneet, और कोई confusion बचा है? हो गया.
Thank you. You were a great audience. Thank you so much for being with us.
Yeah.
For the people on the dais.
Yes, sir. That is what it is. No.
Sir, very nicely conducted. Thank you.
Okay, so thank you, Manpreet and Praful, and Microvision. I think, can the Microvision team come up? We need to thank them for organizing this. All the scientific committee members, Dr. Vanity, please everybody on the stage. And we would like to thank Visakhapatnam for hosting this second midterm, which has been a grand success. A huge round of applause for the entire local organizing committee of Visakhapatnam. It's very difficult to match. I'm sure in future it will be very difficult for other LOCs to match midterm meeting. This was one of the highest standards we have ever had in terms of the midterm meeting. So thank you.